It's a beautiful day at Lowenstein Chiropractic Center. I'm Dr. Tessa Lowenstein, and today we'll be discussing the question, can chiropractic help with knee problems? Now, the first thing we have to address is what's a knee problem? There are many kinds of problems that can occur in the knee. The first one that we look at as chiropractors is that soft tissue injury, namely the athlete, the younger person, but it can happen to anyone, that twists wrong, carries something too heavy, the knee pops, swells. That's a meniscus injury, ACL injury, anything like that. So that's dealing with the soft tissue and the muscle and the joint and the ligament. The next thing we look at is the arthritis word, which no one wants to hear, but it's degeneration of the area. It's a lot of issues as we get older, and both of these particular knee issues can affect the entire surrounding system, whether it's causing us to not walk properly because we're trying to unweight in ways that we shouldn't, or whether it's affecting our spine and giving us all kinds of angles that we don't need to have. So those are the issues we deal with now. How do we help? That's a good question. So for the soft tissue, we want to address the soft tissue. We'll do some muscle work. We'll use instrumentation to address the exact areas of the joint that need help. And then sometimes we'll mobilize the bones in the surrounding area to help really make sure everything is working together as a system. We'll be treating the entire spine as well to ensure that we're stacked properly and that what's happening is not affecting our gait and overall function. The next one is, again, of course, arthritis. Now, it's impossible to reverse arthritic change. However, we can definitely address how tight those muscles must be around the area, whether the joint capsule is moving freely, and what else is going on in the area. We'll do some hand adjusting with that as well. We also have instrumentation that we use, and then we'll look at the soft tissue there as well. The first one, we're primarily focusing on rehabilitation from injury. And on this one, we're looking to recover some of our strength and some of our internal joint mobility when it comes to those big issues there. The last thing we'll talk about as well is surgery. A lot of people come in saying their doctor suggested they see a chiropractor before they seek out knee surgery, and we are definitely proponents of that attitude. We're not saying we can prevent a surgery from occurring, but what we can do is we can help get the muscles, the soft tissue, the joints, even the bones in the proper positioning prior to seeking out that surgical consultation. And on some occasions, we find that that's no longer an issue after rehabilitation was done to the best extent that it could. It's just a matter of having that second opinion and that conversation about how much you have this injury and what we can do to help the surrounding areas and support you through any treatment you choose to seek out. If you're currently suffering from any knee issues, please give us a call at 719-630-7032. We offer free consultations. It does not hurt at all just to hear what we might have to say about your specific issue as well. Again, thank you so much and take care.